clicked on. We are going to be talking about empowering paperless today. It's unlocking efficiency and accuracy in the digital age. You will find that I'm very casual. I'm not a super professional presenter, so you can ask questions throughout the presentation, and I will address them as we can. So here's a little bit about me. I'm not going to go into it. I will share the slides after the presentation, and you can read it on your own if you want. But I have my LinkedIn on there so that we can connect and network. I'm big about networking, so that will be there for you to connect with me. And then this is a disclaimer. It's just saying that this is not a replacement for professional advice. And at the time of this presentation, everything in it was as accurate as I knew to my knowledge. And it's a dynamic industry, so be sure to consult with your professionals and the entity powers that be before you take any of this and use it. And also, taking part in this presentation means that you hold me and any other individual or organization that's represented in it harmless if you have any damages from it, which I don't expect that. But and we're going to start off with the poll. And let me get my poll ready on this other screen. You're going to have a pop-up for this, so you can answer in chat if it doesn't pop up, but give me just a minute. They're loading. All right. So you should see a pop-up, and this is pertaining to the speaker. Which of the following is most likely to occur during this meeting? The dogs will bark in the background, terms will be stuttered or mispronounced, all of the above, or none of the above. So go ahead and select your answer and hit submit, and then the results of that should display in your poll section. If you don't see the poll, again, at the top of your screen, you can click on more and you can click on polls, or it should also be showing in chat. So as we're waiting for the responses to come in, I'll introduce you to my babies. The top two are my grandbabies. They are, let me put my pointer on so you can see. Jelly Bean is my grandbaby. Nanny is my grandbaby. And then the three at the bottom are my actual babies, fur babies, I should say. Scruffy, and you can see why we named him that. Eden, and she's as sassy as she looks there. And then Zoe, she's always pretending to be hurt. You can see her holding her little paw up. So I think going over that probably gave you the answer to my poll, but if you answered all of the above, you would be correct. I will stutter, and I will have dogs bark in the background. And you can see down here at the bottom that I have grandiloquent, which means that you present yourself in a style or a manner that's to impress. And so hopefully you'll still think that of me, even if I have a dog bark in the background. Okay, so the agenda today is we're going to do a quick intro. We're going to talk about how going paperless is still a revolution, how we can empower paperless, the benefits, and the next steps, and then we'll open up the floor for Q&A. So the first thing is, did you know 90% of all medical coders die from stress? Actually, just kidding, obviously. But what we'll cover today will help to reduce your stress some. So hopefully we can make your future days less stressful. And now we're going to jump into a second poll. This is just to kind of gauge where you are right now. What percentage of your daily tasks involve paper documents? And this means if you use paper coding books, if you write sticky notes, if you do anything with paper, what percent is using paper? Less than 25, 25 to 50, 51 to 75, or more than 75%. So while you're diving into that poll, I want to take a moment to say that on the next few slides, we're going to talk about some numbers that will be eye-opening and show you how nearly half of organizations still depend on paper in some shape or form. And this translates to more cost and more time. So hopefully it looks like 76% of you say less than 25%. So that's great. 21% of you are saying 25 to 50%. And then a few of you, 3%, is more than 75%. So that's pretty significant. And we have 150 people in here, and I only have 30 responses. So let's get some more interaction going in the next poll. And of course, I see a bunch in chat too. So if you don't have access to the poll, I understand. All right. So now that we have an idea that a lot of you are completely paperless, and then 3% of you are like completely not paperless, it sounds like, or mostly not paperless. So we'll hopefully give you some tips to do better. So the digital revolution is far more significant than the invention of writing or even printing. This is a statement made by Douglas Engelbart, who is a profound historical impact on our technology. He actually was the one that invented the computer mouse, and he pioneered human-computer interaction. So he's the one who basically laid the foundation for our interfacing into technology. And he also proposed what he called Engelbart's law, which states that the fundamental rate of human performance is exponential. So that just means that our human performance gets more rapid and more rapid. And this is a concept that is even more prevalent when we adapt it with digital complements. The emergence of EHRs actually happened in 1960. I was surprised when I first started studying for this presentation, because I knew it was a long time ago, but I actually didn't realize it was back in the 1960s. So as we know, the EHR is a digital chart of the patient's record. It has comprehensive information such as the history, the medications, the allergies, radiology, treatment plans, collaboration. It has all sorts of stuff in it. And it can allow providers across the globe to access that patient's records so that they can treat them based on their full medical history. And in addition, it's a big part of medical coding and billing. So if you look at the little gray box on the right, you'll see that and they were adopted in 1960s, and they began widespread adoption in 2000. And that is because in 2009, the American Recovery and Reinvestment Act incentivized providers to embrace EHRs. And I'm sure you all remember those days. Those are some of the toughest of the transitions. And as a result, that's when using EHRs skyrocketed. In addition to that, one of those EHRs is still in existence today. One of the first ones was developed by Lockheed, and it was called Technicon back in the day, and then it was TDS, and then it transitioned to Eclipsys, which merged with Allscripts back in 2010, and Allscripts still exists today. So the core features of the modern EHR is digital documentation, digital order entry, automated decision-making, seamless communication, reporting, and interoperability. And I gave the definition of how interoperability applies to this concept, and that's that computer systems and software work together to exchange information through data sharing, collaboration, efficiency, and a patient-centered care model. So that is inherent upon having systems that complement each other, that can be integrated and run seamlessly together. So as we acknowledge the revolution, which will be our next slide, it requires open discussion with your group. And I asked the question, do you still have concerns about your transition that exists today? Even if you transitioned back in the early 2000s, do you still have issues today? Most people can say at least a little bit. And back when it started, it was workflow disruption, potential job losses. Technology felt like it was replacing humans and human interaction especially. And the training and the support and the ongoing learning opportunities were just nonstop. You always had to learn something new about that system. So there was a lot of disruptions in the overall processes. So now we need to learn to embrace the present, embrace the future, and empower ourselves to be paperless. And I put here, it's time to code smarter, not harder, and join the paperless revolution. I say that because I am literally almost paperless. I sometimes jot something down on a notepad or something, but for the most part, I even use electronic sticky notes if I need to do a note. And I love being paperless. If I did not have the feature Control F for find, and if you don't know what that is, we'll talk about that later. But if I couldn't use my electronic coding books and use Control F for find and different things like that, I would not be nearly as efficient. So it increases accuracy, it enhances productivity, it has faster turnaround times, it reduces cost. There are so many good things about paperless. So we're going to talk about statistics on paper-based coding. So the first thing that you have here is 43% of all healthcare organizations rely heavily on paper for coding, and that was just in 2023. Now, paper-based coding costs nearly $24 per chart or claim versus $8 for electronic coding, and that was per AAPC in 2019. And then in 2023, 96% of all non-federal acute care hospitals were using EHR systems. And in the bottom gray box, you see where I've noted that manual coding errors can reach up to 10% or more. And we'll talk about bad paperless systems and how that can even also be even a higher percentage of errors. But in general, being paperless makes you more accurate and more efficient and a better quality overall. So with all these statistics, this being 96%, how come 43% are still relying on paper? If 96% are in EHRs, I would suspect this number to be closer to that. So that's some of the part of why we're exploring this today. So we're going to jump into another poll. And now that I've kind of pointed out a few things, how confident are you in your efficiency and accuracy of your coding process? And again, you should have a pop-up that gives you smiley faces or a frowny face, very unconfident, to a smiley face, which is very confident. And just pick your confidence level and then hit submit. And if you're unsure about this and you're a leader in this space, in this meeting, you should probably conduct a survey with your team to see how they perform in their data gathering, and benchmark yourself against other companies. Because if you don't know the answer to this, then you've got some studying to do. Okay, so right now we're at a 3.5 out of 5 stars. So that's almost neutral about coding efficiency and accuracy. So that's actually one of the lowest scores I've seen. Of course, there's only 28 respondents and we have 162 people in the room. So I'm going to give you a couple more seconds to try and get your response in so we can get an accurate reflection of the group. All right, it's not moving much, but you guys are a quiet group from responding. I'm going to have to fix that here in a minute. Okay, we're going to go ahead and move on. It's still at 3.6% out of 5 stars or 5 smiley faces. So hopefully after this, we can increase that. All right. So now we are going to talk about EHR integration and the resistance that is in place with that. So EHR adoption soared from 9% in 2008 to 59% in 2014, 78% in 2016, and then jumped up to 96% in 2021. The initial bumps were felt. We all felt them if you were in the industry at that point. But it has become a crucial partner in patient care, the patient experience, the delivery of care. It has transitioned a lot of stuff in our healthcare world. The key concerns of the EHR back then and still today is workflow disruption, learning curves, fear of change, and interoperability issues. But with all of this evolution and the undeniable transformation of healthcare, why are there still paper cuts of resistance? That's something that we'll talk about here in a minute. So the workflow disruption, it's natural to feel hesitant. A lot of people do not like change, and they have established their routines and want that familiar workflow. So that is one thing. If you don't like change, workflow disruption can be a negative for you. Or just a change in your workflow. And those of you who don't like it, it actually ends up being a disruption because you do less things efficiently. And then there's the learning curve. Everyone learns at their own pace, learns different ways. And in the transition, there needs to be the option of flexible training option. If you're visual or if you like to read or whatever, tailor those needs to each individual on your team. And then that will ensure that they're confident and comfortable with the new system. And then interoperability issues. This is probably the biggest concern for most people or organizations, because if you rely on technology partners, if they have issues, you have issues. If you can't interface with something, that causes issues. So the interfacing with different systems and different devices and machines and everything can be one of the biggest problems. But the transformation is still undeniable. It has changed the healthcare system inside out, and the acknowledgement of advances cannot be denied. So let's dive into some of these concerns and see what's holding us back. So for workflow disruption, there's a study by HIMSS that says 43% of healthcare providers note that they had problems with workflow disruption during and after EHR implementation. This statistic was for during, but I'm going to say that there's still a large percent that have ongoing EHR disruptions. For the learning curve, AAPC did a study that revealed that 62% of coders felt that they needed more training on using specific features and functionalities of their EHR. Because we're on the practice management side of EHRs, a lot of times I find that when they implement, they train the coders on the billing side, and that's it. And that's a sad fact, because if you knew how that information was coming in, what templates or automated results that they were getting from documentation, and knew how it flowed into the billing side, then you would be better prepared to troubleshoot your mistakes and issues and questions. So that's kind of where that's comes from, is that a lot of coders feel like they're only trained to use specific portions, and sometimes not trained at all. And then for the fear of change, 38% of physicians expressed their concern about the negative impact on their autonomy and their job satisfaction, and that was by the AMA. So this uncertainty about job security, I think we all face that from time to time, and we feel like automation is going to replace humans, and the impact on documentation, and AI is coming around, and all these different resistance that are coming around, and it's causing, anxiety for a lot of people. For the interoperability issues, 52% of hospitals say that they have achieved seamless data exchange. 52%. Greater than half, so I guess that's the positive, but if only 52% have achieved basic interoperability, there's some problems with sharing information. And then some other concerns that are probably the most prevalent outside of the ones we've already gone over are cost and user adoption and buy-in. The initial cost and the ongoing maintenance is there. If you do your initial investment good, the ongoing maintenance should be better. And if you do change management at the front and prepare everybody, user adoption and buy-in should be better. A 2020 study by the American Hospital Association found that the average EHR system for a small hospital is $2.4 million. For a larger hospital, it can exceed $6.3 million. So that initial investment is quite significant if you look at the average of what the studies say. And then the user buy-in and adoption, like I said, all you have to do is add a little bit more change management at the front, and we'll talk about that. So other stats are autonomous coding. 60% of healthcare organizations in a 2023 survey say that they indicate shifting towards AI-powered coding systems. And as you know, in our coding book, there's 3 levels of AI. Just where it gives you a report or gives you the data. The second one gives you a report and data. And the third one like does everything and gives you the decision and everything. So depending on what level you use AI in coding system, it can just be coded assisted, automation assisted, where it gives you examples and you still choose it, or it can be straight up AI does it for you on the onesie twosie ones, and then you only code the most complex ones. So autonomous coding is something that's going to be changing. And then improved outcomes is another stat. Community hospitals in Vermont reported that 60%, there was a 60% decrease in near-miss medication events. That means the wrong medication being given to a patient, or a medication that had a contraindication with another one, because you have that EHR right there in front of you, and it is evaluating all of those medications, and it can say, hey, these 2 have a contraindication, and it can stop you in your tracks. Where back before paperless, you would have to look in the chart, and hope that you knew that there was a reaction between those 2 medications. So the medication events have dropped significantly. And then 25% drop in patients needing to have charts pulled. So that's probably dropping more and more every day, hopefully. Hopefully there's not too many patient paper charts out there. And then embracing integration. Understanding paperless coding isn't just about efficiency. It's about better patient care. It's about professional growth. It's about environmental responsibility, to a lesser degree, in my opinion. That's a political conversation for some other presentation. But then we need to acknowledge the challenges and offer support and guidance. And remember, this is a journey, not a destination, because a lot of people implement their EHRs and then they leave it, and they only go back to it if there's a problem. So ongoing monitoring and adapting is imperative. And so tips that you can do to embrace integration is lead by example. You have to show your team and your teammates that you are actively using and promoting whatever you're trying to roll out. And then create a feedback loop so that if you have problems, there's a way to gather that feedback and address concerns and areas of improvement. And then finally, focus on the people. I'll talk a little bit about this more when we get to the AI piece of it, but focusing on the people is key. Technology is just a tool, and integration requires empathy. So that is something that will help embracing change be a lot easier if you have empathy. So accurate and efficient medical coding and billing is the backbone of a healthy healthcare system. Healthcare providers that are fairly reimbursed and for the services they render, and allowing them to focus on the patient is truly what matters. And then, let's face it, traditional paper often leaves us feeling like we're stuck in the dark ages, or some people, it's a security blanket. So we're going to jump in here and do our next poll. So now that we've gotten a little bit into this presentation, what excites you most about a potential paperless coding? Improved accuracy and reduced errors, enhanced efficiency and saved time, real-life visibility and better control, all of the above, or the final one is we are fully paperless. So go ahead and select your answer and hit submit, and then the poll will show up on your screen. And I'll give you guys a few seconds to fill in the poll. We have 29 responses. It seems like there's 29 that respond immediately. Oh, we're up to 35. Good job, people. There's 162 of you. Come on. Let's get it up to 50 at least. We're at 37, trickling in slow. At the moment, we have 5% that say improved accuracy and reduced errors, 5% for efficiency and save time, 3% for visibility and better control, 65% for all of the above, and 18% are fully paperless. So there's 43 responses as we sit. So that's better. I'm glad to see 43. We're not going to make the 50 mark, I don't think, so we will go ahead and move on. But thank you guys for the ones who did respond. And if you've responded in chat, I don't have it right in front of me. Let me actually pull that up on this side so I can kind of. Okay, yeah, there's quite a few more D's in the chat, which means you were full. Oh, wait, all of the above, all of the above. Okay, I was about to say, I was thinking D was we are fully paperless, and I was going to say if you're fully paperless and you can't find the poll, but I'm kidding. If you can't find the poll, it's probably your device or something like that. Okay, so let's move on. Empowering paperless benefits. And I forgot to say this at the very front. Notice that I've titled this as empowering paperless, and I put less in parentheses. The reason why is because we're always going to deal with some level of paper. We're going to have the patients who hate technology walk in with paper. We're going to have the patients who don't fill out the forms and need paper because they don't know how to use an iPad or whatever. So paperless is the goal. So I kind of did a play on there for those two things. And this is an example of why. If you see the cartoon on the screen, it says we're supposed to watch a presentation called Adjusting to New Technology, but they couldn't get the VCR to work. That's probably a little bit of a stretch. Hopefully nobody still has a VCR, but it proves the point of how some people try and implement technology. They only implement one new piece of technology and everything else is so old and outdated that they can't get them to work together. And that's part of that interoperability that we were talking about. So benefits for healthcare providers. And again, I've got a couple of cartoons on the screen. The first one is better call a technician. You better call a technician because the darn EHR crashed again. And you can see his keyboard is smashed into the computer screen. We all have those providers who are completely without control of their temper, and that might actually happen. And then the second one is we receive guidelines on what we need to do to demonstrate meaningful use for the incentives, or as they like to call it, 50 shades of gray. And that's a very good analogy there because those incentives programs can be really hard to understand sometimes. So for the providers, we have quite a few things that are benefits for them. They gain instant insight. They see it now and they can diagnose it and treat it right away. So that real-time insight for flawless decision-making and prompt identification and correction of potential errors. Streamlined collaboration, they can share this information with others and they can have faster decision-making because they have instant see it now insights. And then the secure data. There's no longer people traveling, hopefully, with a briefcase full of records, medical records or whatever. It's secure in a locked down, password protected electronic device usually. So this reduces risk of loss and theft. And we still have breaches. We all recently went through one and still impacting some today. But for the most part, it's pretty seamless and there's no risk of breaches. And then it has enhanced patient privacy. And then, of course, peace of mind. We can't forget that. And then we have the third bullet of boosting your bottom line. So the financial powerhouse of paperless documentation truly is the faster reimbursement. Turnaround times have gone way better since the transition with EHRs. And then, of course, the reduced cost if you're doing it correctly. So you don't have to pay for the printing, the storage, manual data entry of labor cost. If you do it right, it should be a reduced cost. And then that enhances profitability. And then the next bullet is work harder. I work smarter, not harder. And that goes back to what I said earlier. If you embrace this, you can free yourself of manual task, and you can have automated tasks, and the tedious manual coding books where you have to like flip through the pages. Some of you might still like that. I know a lot of people who still use the paper coding paper books. But it increases our focus and our accuracy, and it improves our job satisfaction for the most part. And then, of course, last but certainly not least is putting patients first. How satisfied are our patients? We'll talk about that a little bit more on another slide, but accurate coding translates to accurate billing, which is faster access to accurate bills. And then they also have access to faster care because of the technology and enhanced delivery. Those bedbound patients no longer have to figure out how to get to the office because now we have so much telehealth and remote devices and things like that. So benefits for medical coders. What's worse, bad handwriting or EHR typos? Like I said earlier in the presentation, paperless isn't completely seamless, and I gave us a few examples. Instead of a cartoon, I gave us actual examples from charts where the documentation has been not up to par. And there also can be contradicting information if you don't have your EHR set up to copy over information correctly and sync in the right places. And then it just comes down to typos. We all make them. You're going to find some of these in some places, but hopefully the overall percentage of inaccurate data is less than when it was handwriting. And the handwriting itself was sometimes just illegible. And the benefits for medical coders are exactly the same bullet points. They just apply in a different way. So we can see it now and code it now. Real insights for all of our proper identification and application of our codes. And we can also correct potential errors instantly because we have instant access to that information. We have streamlined collaboration. So if we have a question, we can message the providers and ask them right then and there. And that can be a document trail in that EHR to show where the error was, how it was corrected, and have a documentation process for when those typos and missteps happen. And then, of course, faster decision making, better turnaround time. We have the secure data. We have the financial stability because faster turnaround times. And we have code smarter, not harder. And that, again, for yourself from manual labor. And then benefits for patients and family. I have two cartoons on here that contradict each other. And this is how it is. You have one extreme to the other. You have the ones that, okay, it'll just be a few more minutes for me to add your items to the EHR. I appreciate your patience. This is usually when either the organization doesn't have good integration where they're handing the patient an iPad and letting them fill out the information electronically, or sending them an email to get into the patient portal and being able to do it in advance. Or the flip side of that is the patient doesn't like technology, doesn't know how to use technology, whatever the case may be, they didn't fill it out before they got to the office. And so now you as the nurse or provider, front desk, whoever, is sitting there trying to get all that information into the EHR while the patient waits. And then the other side of that is I'm obsessed with protecting all my data, so I encrypted myself. And this is the patient who does everything on time, fills everything up, in advance. They go in and change their insurance when it changes. So you have two extremes that you have to deal with patients and family, and the benefits need to be for both sides. So the benefits for patients and the family is improved access to records. There's a lot of times when there's a really sick patient who's bedbound, maybe even on hospice or something, and the family can keep up with what's going on because they've been given access by the patient. You know, the patient can authorize access to the family members so that they can see what's going on. They can request help. They can ask for refills on behalf of the patient. And then, of course, the patient themselves can do it. And then we have benefits for patients with chronic conditions. When they're having to go to a lot of different places and see a lot of different physicians, that record is accessible by everybody if the interoperability of shared data is there. And then patients in remote locations can still see their doctor just by jumping on the computer and turning on their camera. And then last but not least is the patients with limited mobility. I said this a little bit earlier in the presentation, but those patients who can't walk well, it's painful to get out of the house, they are rescued with technology. They have people that can come see them and take care of them either in person, which has always been part of the process, but now they have where they can see them via telehealth. And then benefits for all stakeholders. We can't forget that a stakeholder is anybody who's impacted by the situation. So we have streamlined communication and feedback. We have version control and history tracking, which IT loves, because if you ever, and like we should actually love that too, because if anything ever goes wrong with the backup, being able to convert to a prior version is a big deal. And then automated workflows and notifications, faster project completions, enhanced team productivity, improved decision making, and finally, increased employee satisfaction. And again, these are all examples of what the benefits are. Not every employee may be satisfied. Not every project may have faster completion times, but overall, you should have these benefits. So the direct stakeholders involved here are the coders and billers, the healthcare providers, and the patients that we've already talked about. But the indirect stakeholder is the whole organization, which is payers and insurers, government agencies, technology developers, policymakers, and the list goes on. I could name those all day probably. So we have another poll. You either are going to love me for my polls or hate me for my polls, but I do a lot of polls. So the next one is, have you heard of certified AI medical coder? And let me go ahead and launch that. And you can say yes or no. And I'm looking at a few of the comments while we're waiting on you guys to say if you have heard of that. A couple of you say, I love my coding books. They take notes. Habits are hard to break. Yeah. So I'm going to give you guys a couple of minutes to answer the question of, have you heard of certified AI medical coder, CAIMC certification? 74% say no. 26% say yes. And I meant to do this earlier. I'm going to try and get this link prepared right now. Okay, yes, I can get to that. Give me 2 seconds and I'm going to share the link of what we're going to do, what we're going to talk about here in a second while you guys are finishing filling out your poll. This is slide 33. Okay. Okay, so in chat, I'm going to drop this link. We're at 40 responses, 70% say no, 30% say yes. So I'm going to go ahead and finish that. And over here in chat, I'm going to put a link to the certification. We're going to talk about it again in a minute, but and it's actually an article about it on LinkedIn, but we're going to talk about this in more detail in just a second. So is AI coding taking over coders? This is a question I get asked a lot, and I'm sure all of you probably discuss it a lot and get asked it a lot. But As I've noted here, AI is for enhancing the healthcare system, not a threat to employment. And I firmly believe that. So here are some points to consider. They are complementary to our role, which means it's designed to complement human skill, not replace them, in my opinion. If you have someone that's implementing AI and has a different idea, you need to bring the statistics to the table to prove them wrong. But it takes the over tedious, repetitive tasks and does them, because if it's like cataract surgeries, we could do those in our sleep day in and day out. And the AI can code those for us and leave the more critical, complex cases for the actual coder to do. And then job evolution. This could be a negative or a positive depending on how much you love your current job, but this leads to more jobs evolving versus eliminating them. So you might have a new role with increased oversight of AI operations or something like that, data management or system improvements, but the job doesn't go away, it just evolves. And then enhanced efficiency, it just does. Unfortunately, those of us who hate AI, it is a good thing. It improves efficiency and accuracy in coding, and it leads to better patient care and outcomes, and it streamlines operations. And then continuous learning. If you're in healthcare, you should love continuous learning because you're going to be learning every day of your life for the entire time you're in healthcare. The healthcare sector is dynamic, and professionals have to upskill to remain competitive in their industry. And then finally, the human touch. I want to put this in here because a little bit earlier I talked about people have to be the focus. The human touch is irreplaceable, and while AI can assist us in our decision making, it cannot replace the empathetic decision making and those nuanced understandings that only humans can do. And then I just want to remind you, this is not a threat to employment. It's a shifting of the nature of our work. And then, is AI taking over healthcare? So this, I just put a bunch of articles that have been around. And again, I'm going to share this presentation with you so you'll have access to these later. But there's been tons and tons and tons of articles published for AI in healthcare. Is AI the future of medicine? Absolutely, it's happening right now. It is transforming healthcare in ways that most of us probably never imagined. And it's gone to the fact that even AMA has published principles of AI use, and that is to allow for ethical, equitable, and transparent AI use in healthcare, because we don't want to have unethical things happen. We don't want it to be inaccessible to certain people, and we certainly don't want it to be not transparent. So they put out a set of principles that will help streamline AI use. And then AI is reshaping care. AI has changed medical education practices and regulations tons over the last few years, and we'll talk about a few of those in a minute. And then the FDA has approved a lot of machine learning medical devices, and radiology is probably the most prevalent, where you can take a CT scan from 6 months ago, compare it to a CT scan today, and they can see those minute changes that assist a provider in giving better care and catching things that the human eye may not be able to see. And then is in AI for healthcare, the pros are rapid analysis, early detection, personalized care, telemedicine, and admin efficiency. And this is because AI can evaluate an extensive patient history in seconds and produce a comprehensive treatment plan. That's the rapid analysis. AI algorithms are in place to take an image and analyze it to the highest precision and give us early detection of diseases, and even silent diseases that have no symptoms. And then personalized care is because those treatment plans are now more effectively tailored to that individual. using their history, their DNA, their processes that have taken place throughout their treatment. Whereas it used to be, oh, this chemotherapy works best for breast cancer, let's try it. And it wasn't really personalized to the person so much before. It was personalized to what worked best in the past for everybody as a whole. And then, of course, telemedicine, we have improved remote patient monitoring and diagnosis because we have all those accessible things where you can even just send an app to the patient, a smartphone, and they're able to get what they need to document or monitor what you want. And then admin efficiency, again, because appointment scheduling, insurance claims processing, and all of these other things make things faster and easier. Then the cons of AI in healthcare are data privacy. And although there is a lot of data privacy in the locked down password protection, the AI has raised concerns over security and privacy because of the sensitivity of patient information. So how is AI going to read all that patient information and gather those solutions and you be sure that it's not being shared? So that's where you have to have a HIPAA compliant AI interface, and just using the chat GPT direct with the free version might not be the best way, because if you put your patient data in there, it's shared with everybody, and you have to be sure that you're using it in a HIPAA compliant manner so that you safeguard that PHI. And then there's the ethical decision making implications, where is using AI in healthcare considering ethics when it makes a decision making? Is it not? How is that impacting things? And then we have the integration of healthcare systems, where it can be complex and resource intensive to get every single app that we use and every single device that we use to be seamless in its integration. Regulatory hurdles, they're not fully adopted in the technology yet. So you might have it to use, but is it regulated? Is it approved? Is it considered investigational? Where are we in that regulatory process? And then over-reliance risk. When we rely on AI too heavily, it causes a lot of problems. I love AI. I use it probably every day, but I use it as a baseline, as a guide to my valuable human expertise and my intuition. So if you take away human expertise and intuition and just let AI do everything for you, you're going to have a lot of errors, and it's not going to be tailored to that situation and that circumstance. So over-reliance is a bad thing. And then I say, is AI taking over the world? This is a big question right now. It is a rapid and transformative impact across all industries, not just healthcare. And some of the insights that we see here is redistribution of power. And what I mean by that is this is enabling individuals or small groups to perform tasks that once took large corporations to do, because they have all the data and the AI analytics from it, where they can do a lot more with a lot less. And then we have the rapid advancements, where AI is moving quickly, making technology that once was rare and expensive accessible and affordable. And then we have the transformative impact, how it's reshaping industries and how we work and how we learn and how we travel, how we communicate. The influence on the global power dynamics is significant. The ethical responsibility is the next bullet. There is consensus that the deployment of AI should be a guided process so that ethical considerations are considered. It can benefit society as a whole, but it can be a detriment to society as a whole. And there's a lot of dynamics around that. And then the mitigating risk. This is because there's potential for misuse or unintended consequences. It's a brand new area that we're just diving in the last, decade. And it could be that we don't know what the end result consequences are, and there could be misuse. So put side by side the pros and cons of is AI taking over the world in general on the left side and medical coding on the right side. So on the left side, the pros are job creation and enhanced roles. The cons are job displacement and skill gaps. So we won't talk about that a lot because that's in general. But then on the medical coding side, we have pros of increased efficiency, accuracy, support, and job transformation. And then noticing cons, I also have job transformation, complex claims, and reliance on data. So the reason I have job transformation in both spots is because a lot of people got into the role that they got in because of the way it was. And a lot of people don't want to transform into that new dynamic that's happening. I consider it a pro, but not everybody does. So I put that in both places. And then how can you prepare for this AI shift? Stay informed, update yourself regularly, just like you're doing right now. Do webinars and workshops and just keep yourself involved. Upskill and reskill. And learn about natural language processing. Learn about how tools that can enhance coding accuracy. LinkedIn Learning has a lot of great courses. YouTube has a lot of great courses. Be careful with the source of your information and make sure that it's a reliable source, but explore, get yourself upskilled and reskilled, and then explore new courses and certifications. I just mentioned one that for the medical AI coder. We'll talk about that again in a minute. But explore those new things. Keep yourself in demand. Keep yourself educated. And then collaborate with AI. Embrace AI as a collaborator rather than a competitor. And I say that because AI can handle repetitive tasks. I have AI sending, notifications to myself when certain things happen. It can be really good in making you better at what you do. But also keep in mind that you don't want to overuse it so that you don't stay familiar with your own task and your own knowledge and you start losing your skills instead of helping enhance them. And then, of course, we talk about the ethical considerations. That kind of goes in hand with the collaboration because we have to be careful about what we share. Adaptability and flexibility. Be open to change, be open to learning new things. I feel like it's a daily process, and hopefully you do too. And then patient-centric approach, we cannot forget about the patient. We want to improve patient outcomes, and we want to improve patient experience. And then network and collaborate. This is that interoperability we've already beat a dead horse about, but it's connecting with other healthcare organizations, professional data scientists, AI experts, and collaborating on this information. And if you're able to share the information properly, all that will be seamless. And then advocate for job design. I spoke on this a minute ago, where if you have someone that's implementing AI and they think it can take over the humans, you need to advocate for proper job design, because this means that they're not understanding the benefit of AI as a complement to a human. And they're going to make a big mistake, and the end result is going to be catastrophic if they eliminate that human interaction, where they can highlight the value of empathy, critical thinking, and clinical judgment, all those things that apply. So back to certified AI medical coder. So with all that said, and I think I actually, I have one more link to share. That was the article that I shared earlier. And this is going to be the link to the actual certification. Okay, so offered by Professional Medical Biller Association, or PMBA, they have a certified AI medical coder certification, and it's relatively new, and it's aimed at equipping coders with the knowledge and skills needed to work effectively with artificial intelligence. So I want to point out that this is not widely recognized, and there's not a lot of equivalents to CAIMC for the sole focus on incorporating AI. And because it's relatively new, the widespread recognition and industry acceptance is still under development. I put that in red on the slide for a reason, because I don't want you going to get the certification and then it dissolve and it's never worth anything, because it is brand new. You could be the brave person to go get the certification and be one of the first ones certified, and it lasts 1,000 years. Or you could be the first one to get it and it never mean a thing. So just keep in mind that this certification is brand new. So here is the link to the actual certification. I put it in chat. Yeah, Paula Driver. I'm going to talk about the AI medical billing and coding class in just a second. That is actually next on our list. Thank you for pointing that out. And actually a lot of you have, it looks like. So basically, this is brand new and use it with caution. So now the very next slide, after all of you guys talked about that, is the AAPC free AI course. It is not a certification, but it is a course where it proves that you took the course and you are knowledgeable about that course. I've actually taken it myself, and it was informative. It was a good course. And here's the link to that. So, and I want to inform you guys that copy these links now, because when the meeting's over, you will lose access to chat. Although I'll be sharing it with the officers, so they may be able to share that with you. And it looks like we have a hand up. Angela, I'm sorry, I just now noticed that your hand was up. Do you want to come off mute and speak? And let me make sure I have it where you guys can enable your mics. Hold on one second. And I'm realizing that I didn't allow mics or cameras, so I'm allowing both. If you want to be able to turn on your camera and see each other, you have access. And now you can also unmute yourself, Angela, if you want to go ahead and ask your question. And if you have your hand raised on accident, you can just push the little raise hand icon and it will put your hand down. And since I didn't get a response from Angela, we'll go ahead and move on to Brittany. Brittany, did you have a question?
Sorry about that. I am unable to use the chat. So is there any way that the officers can send us these links? Because mine just keeps saying that something's wrong and to try again.
Okay, gotcha. I will try and put together a list of just the links and send that along to the officers. But they will be going through the chat for those few people who weren't able to register. So yes, I will do my best to get those links to you otherwise. Thank you for that question. And there might be more than just you that are having issues with the chat. So we'll do what we can. Thank you. Okay, so yes, this was free the last I checked, which was just last week. So if you jump on there and do this course, it will show that you passed it, if you pass it, and then it will be on your AAPC transcript for the courses that you have taken. All right, so now we're going to talk about case studies, success and failure. And I was going to open up the floor to questions before we started on this. And it looked like Susan Ball, I think you had your hand up just a moment ago. Did you still have a question? Okay, I'm going to assume that was a mistake. So just out of curiosity, how are you guys liking this right now? Use your react button and give me a thumbs up, a heart, a frowny face, whatever kind of reaction you have for the presentation so far. And some of you are raising your hand versus doing the react button. It's really easy to do. I see some thumbs up. Okay, perfect. I see some hearts. I see some laughs. Okay, I'm glad I've been funny with my cartoons and everything. All right, good, good, good. Okay, so I have a couple of hands up. So Peggy Crisp, did you have a question? You're good. Okay, so I'm going to go ahead and
Thanks.
lower your hand. Oh, did you have a question?
No, that was a mistake. Thank you.
Okay. And then Amaris Gilbert Anderson, I
Yep.
think it is. Do you have a
Yeah,
question?
I do. Can you hear me?
I can, yes, ma'am.
Okay, I have put in the chat. I was wondering how AI has impacted fraud in the healthcare space. Are there statistics or have there been any statistical data compiled as it relates to that? Because, AI from a fraud standpoint is the devil. And,
Yeah.
is we can kind of foresee that it's going to be an issue down the road. So do you have any statistics on that?
I do not. I have not studied that part of it, but that's a very good slide to add to this presentation. So I will see if I can do some research on it. I do know, like you said, AI has a big impact on fraud because it used to be that they had to use their own little algorithms and like do the analytics to figure out how to hack into a system or whatever. And now I'm certain AI allows them to do it way more seamlessly. So that is another one of the unintended consequences, I think we can say, is how is it going to impact fraud? Is it going to help it or hurt it?
I think the biggest issue would be records, duplication of records, and create, like, I've been in symposiums where there was a AI generated medical record that was totally fake, that
Yeah.
literally mirrored an actual, provider's documentation. And it just potentially is going to be a problem.
Yeah, and
Trying to prove what's real.
I think of I'm not sure if I'm going to say it correctly. I think it's Munchausen syndrome or whatever. Is that what it's? Anyway, where parents hurt their kids intentionally, and you probably have. Yeah. And I think that would probably enhance the ability for them to fabricate a medical record in order to get their patient care or their child care and stuff like that. So yeah, there's a lot of potential risk in that area. Good question.
Thanks.
Okay, Susan Ball, I see your hand up again.
Hi, Samantha. Good afternoon. Can you hear me?
I can, yes, ma'am.
Okay, yeah, I was having a little technical difficulties. So my question is regarding the link you sent from, I believe the association was PMBA USA.
Yes.
So that particular link is for the certification, and that one will get you that cert. And that fee, it was, I think, was it $195?
I don't recall what the fee was, but maybe, yes, ma'am. That
Okay,
sounds
I just
about
wanted to be
right.
certain.
Yeah,
I just wanted to be certain.
Yep, that's
Okay.
correct. I would contact them to be sure you got all the information on it, because I don't want to mislead you and that link be to just the refresher course or something like that. But if I remember correctly, that link I shared is to how to get that certification and the cost and information about the certification itself.
Yeah, and the reason why I asked, because when I clicked on the register form, there were different fees involved. So yeah, I'll definitely will reach out to them to get further clarification.
Okay, and if you're our risk taker and you're one of the first ones to take it, I'd love to get feedback on how it went.
Okay, no problem.
All right, thank you.
You're welcome.
All
Thank
right.
you.
Any other questions before we get started on case studies? And I am not watching chat. So Angela, if you see anything in chat, you can bring it to my attention or just speak it out loud so that I don't miss anything. All right, so I'm going to assume that is a no. So we'll move on to the next thing. So case studies, and notice that my images here show robots and humans intertwining here. And for the record, these are AI generated images. I went into Copilot, which is Microsoft's AI product, and I said, create an image that shows humans and technology, humans and AI interfacing. And I said, include hands, because I wanted the handshaking one, and it created it for me. So this shows you how intuitive and how helpful it can be. Okay, so our case studies are going to be going over the success and failures in implementing paperless systems in healthcare. I'm an advocate for both success and failures, because you can't move forward if you don't try, and if you fail, that's a learning opportunity. So I say embrace success and failures, because it can help you move forward and you learn from both situations. So we're going to look at what organizations did right and what they did wrong in their implementation. So case study number one is Cleveland Clinic. Most of you know them. They're a big organization. And in 2018, they did an enterprise-wide upgrade of their Epic software, and it was an 18-hospital system across the country. The clinics they have are 210 outpatient locations, over 66,000 caregivers, and this is in 2018. This could have changed up to this point. And then they wanted to upgrade to standardize their clinical technology and integrate it across their organization. They wanted to customize their screens. They wanted to present different specialty specifics to the right person. And they wanted to be able to have clinical input by partnering with their providers and understanding the needs of them and the patient care they give. And then the final thing was to implement monitoring technology so that they could do remote technology. And notice that this was in 2018, at the very edge of COVID coming on. So they started at the right time, because it was right at that point when we all needed it most. So what they did right was they had a clear vision, and their leadership team was championing the implementation. They were giving them the right tools to do that implementation. They had a phased approach where they implemented it into a single system, started a pilot program across that one department, and then made sure it was perfected before they scaled up to the next level. So a phased approach is sometimes the best approach, especially in a really large organization. And then they did comprehensive training and support. So they made sure that there was extensive training given to everybody, including the coders and the medical billing staff. And then there was ongoing support for any challenges. And then they had a user-friendly technology. They chose a system after heavy research and analysis on what they needed as an organization. And they wanted to make sure it was user-friendly, intuitive, and minimized the learning curve that was needed. And they seem to have done that. And then they also wanted data-driven decision-making. So when you do all these things and you integrate all those systems, you can get all your data in one place and therefore make better analytics and better decision-making from those. So the outcomes of what they did was increased coding, and I'm doing outcomes from a coding perspective. Increased coding accuracy and efficiency, reduced costs associated with paper processes, and then quicker turnaround times for claims processing, which enhanced data quality and reporting capabilities. So they seem to be successful in their implementation. Case study number 2 is a rural hospital system, and I'm not naming the failed ones. I figure why put them in the hot spot, but so a rural hospital system failed. They had lack of buy-in from their stakeholders. And remember what a stakeholder is. It's everyone involved, so patient, providers, coders, IT people. They had a lack of buy-in. They had inadequate training and support. They had technical problems and glitches. And this is pretty common in the rural hospital system, especially back in the 2000s when it was first rolling out, because they didn't have good internet. They didn't have access to the same technology as a big city would. And then you had poor data migration and also unrealistic expectations. So the impact of all these things is that maybe they didn't choose the right technology, or they didn't have the right technology accessible to start the process. When they did data migrations, they didn't have a good handle on what they wanted to migrate where. You really need an HL7 expert, or whatever kind of migration method that you're using. And that would cause inaccuracies and inconsistencies in that data. And then the unrealistic expectations, this has to be blamed directly on the leadership team, because they're the ones that set the expectations. And if you have too quick of a timeline, or you don't mitigate the risk of implementations and phase it out, or don't rally your team and they have disappointment and there's not good change management, whatever. There's lots of things that could cause unrealistic expectations. And the outcomes of that story is decreased productivity and morale, the increased cost due to delays and having to rework things, negative impact on patient care due to inaccurate coding and billing, but there was also clinical side that we're not mentioning here. And then ultimately that system was abandoned and the organization reverted back to paper-based processes. I don't know what the outcome is right now. They've assumed to have tried again and were successful, hopefully the second time around, because it's so prevalent now. But this was an example of a failed implementation. And then case study number 3 is a large multi-specialty group, and they're successful. And they focused on user experience, change management strategies, financial incentives, and continuous improvement. Now, there's a few things I want to point out here, because this is my favorite of the 3 case studies, because they did a user experience focus, and they did their change management. Those 2 things alone, to me, are pivotal in the implementation. And then the continuous improvement is pivotal for the continued success. So, in my opinion, the best job of all of them. And then the outcomes of that is they had increased coding productivity and accuracy. They reduced the administrative cost from not having paper-based processes. They had real-time insights for better decision-making. And the final bullet is enhanced job satisfaction among coders, because it had improved workflows and user experience. So if you do all those things right, the outcome is good. So as a part of these case studies, we have, I've taken those and I've added the AI piece to it. So clinical decision support and early disease detection are the primary ways that AI are used in the healthcare industry. The Cleveland Clinic, when they did their rollout, they did a incorporation of AI algorithms to enhance diagnostic accuracy. That was part of their evolution in their EHR system. So now they're able to use those diagnostic algorithms and improve patient care, and faster, better, whatever. And then the rural hospital system, they overlooked AI capabilities altogether. So that was one of their technical downfalls, is when you're implementing this. I used to implement EHRs. I did that for 9 years. And my first question to a new client would be, what is your dream story? If you had a dream environment, what would it look like? Because I didn't want to just implement the EHR. I wanted to implement the EHR and all the bells and whistles that they wanted to look for. And sometimes I had to bring them back to reality and say, that really won't apply here, or whatever the case may be. But at least you're looking at the big dream. You can plan accordingly and adapt your implementation in a way where it can be able to grow for the future. So overlooking the AI capabilities was one of the mistakes that the rural hospital system made. So these I just did for the case studies that we already went over. But there's another one that I want to mention here real quick, and that's Mayo Clinic. Mayo Clinic is, part of the evolution in AI. They did a really good job adapting an AI specific scenario where they did really good. So before I get into that, I do want to say that the successful implementations that we talked about already, the reason they're successful is because they're still monitoring and adapting. The failed stories didn't. So as we look at the new example, I want you to keep in mind that early disease detection is one of the main reasons why AI exists in healthcare. Mayo Clinic's initiative was to collect and analyze patient data from remote monitoring devices and diagnostic tools and accelerate diagnosing and disease prevention and detection. So they developed a remote diagnostic and management platform that collected this data, and it used AI algorithms to augment, which means assist, human decision making and assist with the clinical workflows that existed. This platform delivered clinical decision making support tools, diagnostic insights, care recommendations, and it helped the clinicians to give a faster, more accurate diagnosis. This kind of couples with another project that's ongoing, where in pre-authorizations, they're doing AI because AI can look at the history of that patient and anticipate what might be coming. So instead of pre-authorizations happening on a per service decision making, AI is beginning to happen on the care plan. So if a patient comes in with cancer and they have their CT scan results or their PET scan or whatever technology was used, the AI can say, okay, it's anticipated that they're going to have 6 months of treatment and it's going to involve this and that, and it can build a story of what they anticipate happening based on that patient's history. And they can go ahead and pre-auth the care plan instead of individual stuff. What that does, though, is it makes, and I shouldn't say though, what that does, thankfully, is it helps make that patient's care journey quicker. Because instead of having to get every individual step pre-authorized, it's already authorized up front. So if they get in there and they realize, ooh, the lesion on the liver is bigger, let's go ahead and send them over for an MRI or PET scan or whatever, again, whatever technology they decide on, they can send them straight over and not have to worry about a pre-auth because it was already authorized in the care plan. So that's a fairly new launch, but it's a pretty big one in my opinion. And that's kind of what Mayo Clinic's initiative is to have a clinical decision support system. And then there's Anumana, and I'm not sure I'm pronouncing that right, but Anumana and Lucem Health, which was the two companies that partnered with Mayo Clinic in launching this. And then, let's see. I want to make sure I'm not forgetting anything. Okay, yes. So that was the venture into AI, and that is a pretty big one, and I feel like that's going to have a big impact, and AI is happening all over healthcare, and it's evolving quickly. Outside of AI, outside of healthcare, we have several areas that are being impacted. So let's move on to the next slide. So Mayo Clinic Initiative is happening. Anumana and Lucem Health is partnered with that. AI in healthcare is growing leaps and bounds with early detection and continuous care and addressing, the large picture. The workforce dynamics are emphasizing natural motivation by the team and learning from failures and supporting by compassionate leadership. And then beyond healthcare was one of the very first organizations or industries to dabble in AI. But transportation and logistics is using it to optimize routing, enhance safety. GPS is on almost every delivery truck there is. Finance and banking have implemented it to assist in fraud detection. So that goes back to your question. I'm not sure who asked it, but the fraud stuff, the banking industry is using it in detecting the fraud activities. And then they're using it for risk management and customer service automation. I'm sure all of us have called the new customer service lines and it says, how can I assist you? And then when you say it, they're like, did you mean so-and-so? Hold on, let me connect you to the next available person or whatever. And if you do it online and chat, it's even more intuitive because it'll give you like a list of selections. And then if you don't want that, you put in your own selection and it migrates to the right place based on what you've answered. And then retail and e-commerce, they're doing this for inventory management and personalized shopping experiences. So I know all of you have seen the commercials that are tailored to you, and when something pops up, it just so happens to seem like what you wanted. That's not coincidence. It's the AI technology at its greatest. And then we have manufacturing, where it can enable quality control and supply chain optimization, kind of coincides with the transportation. And then you have entertainment and media, where it curates content. If you haven't seen some of the stuff that they have curated, and even you can tell which cartoons are now like computer generated cartoons and everything. It enhances user engagement and streamlines production processes. I kind of hate the AI entertainment, but some people might love it. And then energy and aerospace are also some of the areas. Aerospace is pretty exciting because they're using AI navigation systems, and it helps with flight operations and plane detection. And it's been in aerospace for a long time, though, and the military for a long time, the government for a long time. It's just now trickling out into public. Okay, so the case study takeaways are user-centered approach, effective implementation strategy, technical considerations, and ethical considerations. Those, in my opinion, are the 4 core areas that have to be addressed before you can move forward with safe, effective digital technology, AI, whatever it may be. And then by focusing on those 4 areas, you can create the right environment, implement a well-defined strategy, and address the technical and ethical considerations in that process. So I put in red here again because success and failure can be subjective, both technical and philosophical, because it depends on a various amount of factors, financial performance, market acceptance, outcome, etc. So I put that out there because success to one organization may not be success to another. So you have to tailor it to your experience. Okay, so now we're moving on to our next poll. Let me pull up my polls here. You thought I was finished, I bet. Hold on just a second. It's refreshing. Okay, so now that we've gone over all of this information, what would most encourage you to adopt paperless processes? And this is a multi-select. You can select as many as you want. So user-friendly interface and workflows, comprehensive training and ongoing support, financial incentives for efficient use, clear communication for involvement in the processes, and I've already adopted paperless. And after you make your selection, hit submit, and then you'll see the results on your screen. One thing that I want to point out here, C says financial incentives for efficient use. I forgot to mention in one of the earlier slides is that one of the ways that one of the success case studies, they did incentives for efficient use. So if you got like 90% use of your technology, they might give you a bonus or something like that. So the financial incentive is a great way to motivate your staff to adapt to a change that you're doing. Okay, we only have 23 responses. Did people go to sleep on me? We still have 162 and only 26 responding. I should have like a cow horn that I can blow so that I can make sure everyone is paying attention still. But we do have quite a few people in chat. So, okay, so we have 28% for user-friendly interface, 23% for comprehensive training, 16% for financial incentives. That was a little surprising. 20% for clear communication, and 14% are already adopting paperless. So we'll go ahead and move on to the next slide. If I can find my mouse, okay. So the next steps for empowering paperless is going to be, for coding and billing specifically, is going to be assessing your current state. What are your existing workflows? What is your technology infrastructure? What is the stakeholder feedback? There's a lot of things that you can do to assess the current state. Then you want to develop an implementation plan. And keep in mind, these next steps are, even if you're already completely paperless, these should be things that you're doing on an ongoing monitoring perspective, and then adapting and implementing whatever changes need to take place. So don't think of this as just the initial change. This is ongoing forever. So assess the current state, then develop an implementation plan. This means define your goals, your objectives, set suitable solutions, develop a phase strategy if it's necessary. What does the implementation plan look like? Have you assessed your risk and benefits from it? Those types of things. Then the next thing is ensure user adoption. This is monitoring and adapting, ongoing continuous change that has to take place. So ensuring that you also have user adoption for every change that you implement is imperative. So you invest in comprehensive training, you offer ongoing support, you promote user engagement. Those financial incentives is a great way to do that. You just make sure the change management is there. A lot of places have dedicated change management teams these days because change does happen so rapidly now. And then we optimize and monitor. I kind of said this at the very front. Optimize and monitoring is going through all these steps over and over again, and you optimize it and you monitor it. You optimize it and you monitor it. So that's continuous engagement of your usage and performance metrics. That is leveraging your data analytics, because hopefully you have a seamless interoperable system where you have a lot of data that's collected, and you refine those workflows and processes accordingly. And then finally, foster a culture of innovation. You want to encourage your team to want to do better. You want to encourage them to bring ideas to the table. You want to stay informed about emerging technologies, and just overall be better every day. And then a few items that kind of come to mind as I think about the paper world that used to exist and the paperless paradise that we're in now. This first one is paper chase versus paperless paradise. And I just do a couple of images here to kind of dictate. I will give away my age. I started in healthcare in 1993, and it was rolling chart, file cabinets, tons and tons of documents overflowing in the rooms, and sometimes we would have mounds of paper sitting next to the scanning machine so that we could scan images, because we were keeping, even back then, keeping some things on the computer, but the chart itself was pretty well paperless. So it was fascinating to see the transition over these years. Then we have paper piles versus digital declutter. So I want to emphasize this because those mounds of paper charts that we used to see on our charts is one thing. It was something, like it says in my notation here, threatening to avalanche at any moment. But the digital declutter, if you implement your system correctly and you have an effective hierarchy of folders and places for storage, this is going to be a great thing. You can search and find what you need. But if you have everything thrown in one big pile and you don't have a good keyword search ability, you can make your digital environment as ineffective and maybe even less effective than what it used to be with paper pile-ups. And then Paper trail versus digital highway. Back in the day when a patient wanted a new medication, you had to flip to the front of the chart where what they used to call a face sheet was, and it would have the history sheet, and it would have all the patient's medications on it, and you'd have to reconfirm, are these still the medications that you're on? And you had to rely on the patient knowing that, where now you have interfaces with the pharmacy where you know exactly what was ordered, the milligram to the instruction and everything, and you can search that quickly. And then you have your medical contraindications in there where it's looking at everything that's on that patient's chart and making sure there's not going to be any risk. And then it will give you a pop-up that says, hey, yeah, there is a risk. So now imagine having to go back to the paper chart versus what we experience today. And then paper memories versus digital recall. This is kind of the same things. The doctors were having to rely on remembering what that history was or going back and refreshing their memory on what that history was, where the digital recall, where it can pop up and remind the doctor, hey, this is due, or hey, this was going on. And it can really prompt better care plans and everything. And from a coding perspective, now you have all the prompts that says, especially if it's custom to that group, so-and-so MPI is not supposed to be performing services at this place of service, or whatever kind of pop-up you might want. You can have a prompt to give you a recall on something that's not supposed to happen and help reduce errors. And then paper shredder versus secure cloud. Of course, we do still have paper to shred, and there is still shredding companies that come and pick that up and everything. But for the most part, those big, huge mounds of paper shredders that we used to have are very slim now. And we have that secure cloud where we can keep everything, keep up with it. And if a fire happens, it doesn't burn to the ground. You hopefully have a good backup that you can still get that access to the records and everything. So secure cloud is definitely a big benefit compared to trying to find paper or handle paper. Okay, so this brings us to the end. I have listed the majority of the references that I use throughout this. There's actually 2 pages worth. If you wanted to go, excuse me, and look at those references and find what I did to put this together. And then that brings us to our last poll. This one, you can use your little a QR code, or I also have a launch one. There are actually 2 different ones. The one on screen with the QR code is a more comprehensive one. It will help me perfect my presentations and be a better speaker for you. And then the one on the screen is simply just a rating, 1 to 5 stars, 1 star being completely poor and 5 being excellent. So you can click on that and then rotate into the next question. There's actually 3 questions here. Where did my presentation meet your expectations? And then you can choose met, did not meet, met, or exceeded your expectations. And then the last one is use an emoji to explain how this presentation, your reaction to the presentation. I'm sorry, my voice is getting skippy on me. So I had happy, neutral, bored, surprised, and thought-provoking were the emojis, and you can do more than one. And then once you choose your answers, just hit submit, and then you will get the results on your screen. So thank you. 95% of you gave me 5 stars, 4% 4 stars, so that's awesome news. I'm going to leave that poll open so that you can continue to answer it. It's going to be sitting in your chat area. And then the last slide that we have here is Q&A. So with all that information that I just gave you, does anybody have any questions?